Good day, ma'am and sir. My name is Gwyneth Marietta T. Cabilino, a second-year BS in nursing student from the University of Mindanao. Today, I will perform the perineal care or external douche procedure. It is cleaning by way of washing the genitals and anal area with plain water or medicated solutions. Check the client's chart to verify the doctor's order. This is to ensure that you are doing the procedure to the right client. Identify the client and establish rapport. This is to elicit cooperation with the client, and explanation reduces apprehension. Good morning! My name is Gwyneth. I am your student nurse for today. May I know your name and date of birth, please? Okay, thank you. So how are you feeling today, Mrs. Gray? Okay, but don't worry, the procedure I'll perform today will help you feel comfortable, okay? Alright, I'll just wash my hands. I'll be right back. Wash hands. Hand washing deters the spread of microorganisms. Explain the procedure. This is to allay clients' fear and anxiety. Alright, Mrs. Gray, for today I will perform the perineal care. This procedure is done to cleanse your perineal area from bodily secretions and will help eradicate foul odor and also prevents you from having skin irritation or infection, okay? Screen the client. This is to provide privacy and assurance. Gather all materials needed and place at client's bedside. This is done to save time and work efficiently. Place the client in a dorsal recumbent position. The client will lay on her back. The knees will be flexed while the sole will be resting on the bed. Alright, Mrs. Gray, right now I want you to separate your legs and then your knees will be flexed while your sole is lying on the bed, okay? This is for the client to have a comfortable position and accessibility to the nurse during the procedure. Drape the client by exposing only the part to be cleansed using a triangle draping method. Fold the client's gown up above the genitals using top sheet. Fold the linen in a triangular shape so that the base of the triangle will be at the top of the client's knee. The pointed ends of the base will be wrapped around the client's legs. Providing privacy can ensure a trusting relationship with the client and elicits cooperation. Put on pair of gloves. Wearing gloves protects exposure from blood and body fluids. Okay, Mrs. Gray, right now I will first check your perineum, okay? As per assessment, the client's perineum has presence of erythema and swelling, and there is absence of foul odor. The discharge is pinkish to brownish, while the volume is scanty. Bedpan. This is to catch water and secretions drained from flushing the perineum. Wet area with sterile warm water for soothing effect. I will now put this water. Is the water okay? Using pick of forceps, get 7 cotton balls soaked in a soap sud solution. Using a working forceps, get cotton balls soaked with soap sud solutions and clean starting from the midline of the symphysis pubis down to the anus in a downward stroke. Never retrace stroke to prevent the spread of infection. Get another cotton balls and start cleaning from mons veneris or pubis in figure of 7 motions by way of labia minora down to the anus. Then discard used cotton ball. Do this on the opposite side with the same stroke, but with the use of another cotton ball. Secretions that tend to collect around the labia minora facilitate bacterial growth. Get another cotton ball. Start cleaning from the mons veneris or pubis in a figure of 7 motion by way of labia majora down to the anus. And discard the cotton ball. Do this on the opposite side and again use another cotton ball. Clean the groin and inner thigh and do the same on the opposite side. Flush thoroughly with sterile warm water. Dry with gauze using the same technique.
Remove the bedpan and turn the client on a side-lying position and clean the buttocks if necessary.
Okay, Mrs. Gray, right now I will remove the bedpan. Okay, in the count of 3, can you lift your butt? 1, 2, 3. Very good. Okay, so right now I want you to face to your side so that I can clean your buttocks, okay? And then I will also put the perineal pad. Okay, in the count of 3. 1, 2, 3.
Buttocks and back should be kept dry also.
Okay, I will be exposing only this part.
Put perineal pad under buttocks for client's discharges. Change the rubber sheet if necessary. Reposition the client to provide comfort.
Okay, Mrs. Gray, I am done with the procedure. You can lay properly now in your bed, okay?
Do aftercare and remove gloves. This is to maintain cleanliness and orderliness. Wash hands. Hand washing deters the spread of microorganisms. Check back clients for feelings of comfort.
Hi again, Mrs. Gray. So how are you feeling? Even better? Okay, that's good. So is there anything else you want? Okay, thank you so much, Mrs. Gray.
Document the following: date and time, procedure started and finished, response of the client during and after the procedure, any unusual findings of redness, skin breakdown, discharge or drainage, and localized areas of tenderness.